Mr. Speaker, our plan throughout this crisis has been to slow the spread and protect the NHS. Thanks to the resolve of the British people, the plan is working, and we're now in the second phase of this fight. And I want to update the House on the next steps that we're taking as part of that plan. First, we're protecting the nation's care homes with a further £600 million available directly to care homes in England. We've prioritised testing for care homes throughout, and we've made sure that every care home has a named NHS clinical lead, and we're requiring local authorities to conduct daily reviews of the situation on the ground so that every care home gets the support it needs each and every day. All of this amounts to an unprecedented level of scrutiny and support for the social care system, and a level of integration with the NHS that is long overdue. Second, Mr. Speaker, the 4 UK Chief Medical Officers have today updated the case definition to include a new symptom. Throughout this pandemic, we've said that if you develop a new continuous cough or a fever, then you should immediately self-isolate. From today, we are including anosmia, which means that if you've lost your sense of smell or are experiencing a change in your normal sense of smell or taste, that can be a symptom of coronavirus, even where the other symptoms are not present. So from today, if you develop a continuous cough or fever or anosmia, you should immediately self-isolate for at least 7 days in line with the guidelines. Members of your household should self-isolate for 14 days. By updating the case definition in line with the latest science, we can more easily recognise the presence of the virus and more effectively fight it. Third, Mr. Speaker, we are expanding eligibility for testing further than ever before. Over the past 6 weeks, this country has taken a small specialised diagnostics industry and scaled it at breathtaking pace into a global champion. Yesterday, Mr. Speaker, we conducted 100,678 tests. Every day, we're creating more capacity, and that means more people can be tested, and the virus has fewer places to hide. Today, I can announce to the House that everyone aged 5 and over with symptoms is now eligible for a test. That applies right across the UK in all 4 nations from now. Anyone with a new continuous cough, a high temperature, or the loss or change of sense of taste or smell can book a test by visiting nhs.uk/coronavirus. If you're eligible for a test and you don't have internet access, you can call 119 in England and Wales, or in Scotland and Northern Ireland, 0300 303 2713. We'll continue to prioritise access to tests for NHS and social care patients, residents and staff, and as testing ramps up towards our new goal of total capacity of 200,000 tests a day, ever more people will have the confidence and certainty that comes with an accurate test result. Fourth, Mr. Speaker, I want to update the House on building our army of contact tracers. Today I can confirm that we have recruited over 21,000 contact tracers in England. This includes 7,500 healthcare professionals who will provide our call handlers with expert clinical advice. They will help manually trace the contacts of anyone who's had a positive test and advise them on whether they need to isolate. They have rigorous training with detailed procedures designed by our experts at Public Health England. Mr. Speaker, they have stepped up to serve their country in its hour of need, and I want to thank them in advance for the life-saving work that they're about to do. The work of these 21,000 people will be supported by the NHS COVID-19 app, which we're piloting on the Isle of Wight at the moment and will then roll out across the rest of the country. Taken together, this means that we now have the elements we need to roll out our national test and trace service: the testing capacity, the tracing capability and the technology. Building that system is incredibly important, but so too are the basics. We need everyone to self-isolate if they have or if someone in their household has symptoms. We need everyone to keep washing their hands and following the social distancing rules. We need everyone to stay alert, because this is a national effort and everyone has a part to play. The goal is to protect life and allow us carefully and cautiously to get back to doing more of the things that make life worth living. That is our goal, and we're making progress towards it, and I commend this statement to the House.